Hi, my name is Abe. I'm a fourth-year PhD student at the University of Washington, and then I received the PhRMA Foundation Predoctoral Fellowship in drug delivery. It wasn't until college that I actually decided I want to become a scientist. During my freshman year, I took an intro in bioengineering class, and that's when I kind of learned that being a scientist can be more than trying to understand how things work, but it can also be about taking all the tools and knowledge that we have around us to try to build new technologies and try to solve problems, especially in healthcare. I think working in drug delivery especially, I realized how being a scientist really allows me to combine my creativity, critical thinking, and also doing a lot of hands-on work to try to solve problems that can really help other people. So my research focuses on developing biomaterials to make cell therapies more effective and also safer. So cell therapies are therapies where you take the patient's own immune cells and then engineer them so that they can recognize and then kill cancer cells. But because tumors and healthy tissues can look actually pretty similar, oftentimes these engineered cells can recognize and then attack the healthy tissues. And that can cause really life-threatening side effects, especially in the context of solid tumor treatments. What we're developing are these materials that can accumulate in the tumors and then act as local activation signals. The idea is that we turn these engineered cells on and make them active only when they are inside the tumors. And so by doing that, we're hoping to make cell therapies safer, because when they're circulating throughout the body, they're not active. And then so we really hope that by doing this, we can make cell therapies more effective and also much safer so that they can be available to more cancer patients. So I think one funny thing about my PhD is that I became much more than just a researcher. I actually became an expert in a lot of instruments and techniques. And so people come find me when the flow cytometer breaks, when the HPLC breaks, when the plate reader breaks, or when the computer just stops cooperating. I actually really enjoyed that part of my training. I get to see how different instruments are built, how different systems work, how to diagnose problems, and then how to fix problems. And then also, kind of in the process, help other people succeed in their research when they use these instruments. I think what I love most about research is that I get to use both my brain and my hands. I really enjoy thinking about problems, but I also really enjoy building things and then making ideas work in real life. And I think research really lets me do both. I think on a more personal note, I've watched both my dad and my dogs go through cancer and then cancer therapy. So I also think a lot about the patients and their families behind these diseases that we're studying, and also behind the therapies that we're trying to design. And so I think it makes the work that we do, especially in drug delivery and also research in general, feels very real. I enjoy cooking and baking a lot. I think it's actually very similar to doing experiments with a much higher likelihood of success. I also like to read. I like to swim, and recently I've gotten into free diving, actually. I would probably encourage my younger self to not be afraid of asking for help. I feel like some of the biggest opportunities in my career actually came from my mentors, my collaborators, and also sometimes my friends that are willing to support me when I actually reach out. I think my long-term goal is to continue to working in this area, drug delivery, especially for cancer and immunotherapies. And I want to continue to do research that has very real clinical impact. And then right now I'm more interested in pursuing academia. And so I think after my PhD, I'll probably do a postdoc to continue my training.